During your golden age, you either spend money to stay in the hotel or you spend money to stay in the hospital.
Hospital. Oh, that's a very sad truth. Huh?
Yeah, but it is a truth. The key point about taking majority of the medications, insulin or supplements is that the sugar never left your body. That would be easily more than 200,000 medications alone. We have not even discussed about the cost of complications here. Worse still, dialysis.
Wow.
What is the cost of dialysis per month? How many people actually get into big debts because of dialysis? And when he saw me, he was on like 4 or 5 medications plus 98 units of insulin.
Every day.
Every day, he was jabbing himself 4 times a day. Within 6 months, I reversed his condition completely. The longest diabetes we have reversed is 36 years. The longest hypertension we have reversed is 47 years. That means the doctors will always say that you have to take this for the rest of your life.
It's like a life sentence, right? From now on, no choice already. Take medications until you die.
There is not a single medications or supplements, or insulin for that matter, that can reverse diabetes. Diabetes can only be reversed using the right knowledge.
Welcome to the No Sweet Talks podcast.
Where we share with you the ugly truths about diabetes, which most doctors may not share with you.
I am your host, Ian, and we're very glad to have Dr. Andrew from Clinic Zero, who has successfully helped over 2,000 patients reverse their diabetes.
Thank you for having me here, Ian.
So, Dr. Andrew, according to IDF, International Diabetes Federation, one leg got amputated every 20 seconds because of diabetes. So I'm going to ask you first, why is diabetes so scary?
Yes, indeed. So in diabetes, there's a lot of sugar in the blood vessels. And this sugar will cause inflammation over the blood vessels. So over time, these blood vessels will be blocked. So you can imagine, if the blood vessels are blocked in the brain, it causes a stroke. If it's blocked in the eyes, it causes blindness. If it's blocked in the heart, it causes a heart attack. If it's blocked in the kidney, it causes kidney failure. And if it's blocked in the leg, it causes numbness first, followed by amputation. In fact, anyone who is a diabetic, the risk of all these complications goes up by at least 2 to 3 times compared to a normal person.
Wow, that is scary.
That is, yes. So it's the complications that is really deadly.
The amputation, right? It only will get worse, right? Maybe you got your toes amputated and it didn't stop there. Is it true? Or once you got amputated, then it's done already? Diabetes is off forever?
No, it's progressive. Yes. So because the structure of our blood vessels is like the branches of tree. So you can see as it goes more to the end, it is actually narrower. So the blockage usually happens at the very end first. Example, the tip of the toes. So that's where it gets blocked first. That's why the amputation starts there. That's why you see a lot of amputation starts with the toe first, and then slowly it will go up. It will come up to the ankle, and then after that it go above ankle, and then below knee, and then of course the worst one is above knee. So the amputation is actually progressive. As long as we do not reverse the diabetes, this can actually go on.
So don't think about just losing a toe. Probably it would be even worse, losing your foot and then maybe the whole of your calf even, or even to the knee part.
Yep, that's right.
Wow.
Yeah. Yes.
Okay, that is scary. Will medications, insulin and supplements make diabetes even worse?
See, think about it. This is how most doctors convince diabetics to take medications, right?
Yeah.
Think about it. No one likes taking lifelong medications, right?
True.
Yeah, imagine popping in pills every single day, or worse still, you have to inject yourself with insulin every single day. So how doctors convince patients is like, as long as you take these medications, we can minimize or prevent the complications. But do they? Think about it. Do you have family and friends who are diabetic? They have been very disciplined in terms of taking all these medications and things like that. Do you notice that they somehow still end up with one of the complications? Example,
yeah,
let's say a
true.
stroke or something. They do, right? Question is, why?
I thought it's supposed to like help.
Exactly.
Help it.
Yeah.
Yeah.
So they, according to a clinical study, it's called a ACCORD study, ACCORD, that is actually published in the New England Journal of Medicine back in 2008. So what they did was they took 10,000 diabetics in US. They split them into two groups, 5,000 each. The first group, they put them on the standard therapy, whereby they don't increase the medication insulin. So the sugar control wasn't that good. It was around 7.5% for the HbA1c. The second group, they put them on an intensive therapy, whereby they increase the dosage of their medications, insulin, and they pull down the sugar reading to about 6.5% for HbA1c. So what would you expect from this? Which one will fare better? The standard therapy group or the one with the intensive therapy group where the sugar reading is better?
I would think the more intensive one.
Exactly. That's what they thought. But in the end, you know what happened? The group with the intensive therapy, their death rate increased by 22%.
So that means the more you take,
Correct.
the faster you
Actually die from some of the causes. Yeah.
Doesn't
so
make
that means
sense.
the better sugar control you have with the medication, the faster you actually die.
And it doesn't make sense at all.
Yeah. Because of this, they ended the clinical study 18 months ahead of time because they realized that it was not ethical for them to proceed with the study.
I see.
So
Okay.
this is why, despite taking the medications, insulin or supplements, right, you notice that diabetes still end up with the complications.
But this is like quite common lah. Like elderlies, normally they will have the idea of, okay, when I reach a certain age, I would definitely develop it, right?
Some complications, something like that, right?
Yeah. And then I would think that by taking medications, by taking supplements, it's going to help me than making it worse. So why is it so?
Right. So you see, we understand that these medications and this insulin and these supplements, they don't really prevent complications. But the question is, why? What is the reason behind it? Isn't it very sad?
Yeah.
So this is the key reason why I help patients to reverse diabetes. Think about it. Ian, if you have rubbish in your kitchen, where would you throw the rubbish? I will offer you two options now.
Yeah.
Option one, you are going to, of course, pack it nicely and throw it outside your house.
Yes.
Just outside your house, not your neighbor's house, okay?
Yeah,
Just
yeah.
outside your house and wait for the truck to come and pick it up.
Yep.
Option two, you're going to basically pack the rubbish nicely and throw it into your guest room. Let's say your guest room
Okay.
is just next to your
Okay.
kitchen. That's how it works, right? Ground
Yeah.
floor. Yeah. Okay, which one would you go for?
Of course, outside the house, unless I really
Yeah.
dislike my guests.
Yep. So, I mean, anyone in their logical mind will never throw rubbish back into their own house, right? I mean,
Yeah.
although it's a guest room.
Yep.
Yeah. You will definitely throw it outside, right?
Definitely.
Now, let's come back to diabetes.
Uh,
In diabetes, there's a lot of sugar in the blood vessel. So, what do doctors do? They prescribe medications, insulin, or some people even sell supplements to you. They tell you that they lower the blood sugar, which is right. Nothing is wrong there. So, you see, anyone who has taken medication before, they know that when they take medication, their sugar will drop.
Yep.
I mean, this is. I mean, everyone knows that.
Yep.
But we have forgotten to ask the next question. Where is the sugar now?
Where is it going? Yeah.
It has
okay.
left the blood vessel. Yes, true. Where is it? So Ian, let me ask you the same question again. Where do you think is the sugar now? Two options. Number one, it has left the body. Number two, it is still inside your body, but in different parts of the organs.
Just like you said, it's inside the guest room rather than gone out already.
Exactly. So if the sugar goes to the brain, it causes a stroke. Goes to the eyes, blindness. Goes to the heart attack. Goes to the kidney failure. It goes to the liver, it causes fatty liver. That's why majority of the diabetics also suffer from fatty liver and they don't know what to do about it. You know, in Clinic Zero, we can help patients reverse fatty liver in 2 weeks' time without any supplements, no liver tonic, nothing.
2
It can be
weeks?
reversed naturally just like this. A lot of people suffer from 10, 20 years and they don't know what to do. Alright, so if the sugar goes to the leg, obviously it causes numbness and then followed by amputation. So the key point about taking majority of the medications, insulin or supplements is that the sugar never left your body.
Wow.
So think about it. If you have been taking the medications for the past 10 years, what you have done to yourself is you have literally been throwing the rubbish back into your own body for the past 10 years.
Wow. And on the financial side, 10 years of medications, how much would it roughly be?
If you want to take it as, let's say, we do a ballpark figure.
Okay,
Let's say we
okay.
take $200 per month
Yeah.
for the medications, insulin supplements
Yeah.
with the follow-up with your doctors. In 1 year's time, how much you will end up spending? $200
$200
times 12.
times
So that would be 2004.
2004 USD
2,400.
we're talking about.
2004 USD.
Yeah.
So most diabetes live 20, 30 years. So if you take the 24,
Okay.
the 2004,
2004.
multiply by 20
Wow.
years, how much would that be? That would be like,
6 figures.
yeah,
Yeah.
wait, about
200,000?
50,000 US dollar.
US dollar. Yeah. Okay. Times 4.5.
Yeah, that would be easily more than 200,000 medications alone. We have not even
okay.
discussed about the cost of complications yet. Can you imagine if we start calculating the cost of heart attack? How much would one heart attack cost if you were to be admitted into a private hospital? Worse still, dialysis.
Wow.
What is the cost of dialysis per month? How many people actually get into big debts because of dialysis?
And,
I'm also taking care of a dialysis center myself, so I understand this very well.
And when it comes to diabetes medications and all that, insurance won't cover, right?
Basically, diabetics are not eligible for medical insurance. I mean, these companies, they are smart. They know that anyone who is a diabetic, the risk of them getting complications is so high that they wouldn't want to cover.
Wow.
Yeah, this is the bad news. The good news, under Clinic Zero, we have quite a number of patients who successfully purchased their medical insurance after they have reversed their diabetes.
Wow.
Because reversing diabetes means you're actually normal. So from the insurance company perspective, you're actually normal.
Okay.
That's why they allow you to buy insurance.
But
because
Dr.
you're no
Andrew,
longer a diabetic.
Talking about this, those people who have gone through 10 years, 20 years, is it too late to reverse?
Not really. Talk about one of our success case. We have a gentleman. His name is Mr. Leong. When he met me, he was 72 years old.
Wow. Okay.
And he was already suffering from diabetes for the past 36 years.
Wow.
So he was diagnosed with diabetes at 36. When he saw me, he was already 72.
That means half of his life he's
Exactly.
been carrying diabetes.
He's actually, yes, he is diabetic. And when he saw me, he was on like 4 or 5 medications plus 98 units of insulin.
Every day.
Every day. He was jabbing himself 4 times a day.
Oh, okay.
And what happens? Within 6 months, I reversed his condition completely. After 6 months, he's no longer on medication, no insulin, no supplements.
Okay.
Yeah, and he's
Free,
Yeah,
basically.
he's free, basically. Yeah, he's free. He's
Wow.
liberated from diabetes.
Okay.
And of course, this case was also published in the newspaper. He was interviewed by one of the newspaper. Yeah, for his success stories.
So that's why at 72, it is still not too late. In fact, within half a year, Dr. Andrew has helped this patient to reverse it and given him the freedom of life again.
In fact, he is not my oldest patient. My
Which one is
oldest
the
patient is 93 years old.
Wow.
The longest diabetes we have reversed is 36 years. The longest hypertension we have reversed is 47 years. That means the patient suffered from hypertension for 47 years and we reverse it naturally for the patient. Yeah.
Wow, that's such a brilliant story to hear. So I would imagine they would say something like, I should have known you earlier, right? Then they've saved 20, 30 years of my life.
This is a common feedback. I mean, I'm honored for that. And this is the exact reason why we score pretty high on our Google reviews. We have, to date, about 470 over Google reviews.
Google reviews, yeah.
We actually score 4.9 out of 5 stars.
Oh, wow.
Because if you put yourself in the patient's shoe, right, their life is literally transformed. Like, can you imagine from with so many medications to without medication, and with a better sugar control, and you worry less about complications. Of course, I wouldn't say that when we reverse diabetes, all your complications is like, oh, you will stay out of it forever. We cannot promise that.
Yeah.
There's no guarantee. But at least it's minimized. At least it's better than you taking medication and then pushing the sugar, so-called the rubbish, back into your own body and increasing the risk of complication actually.
Yeah, and you also do give them hope. Like, okay, to live your life to the fullest and no need to be worried so much about,
Correct.
carrying medications
Medications.
everywhere.
Correct.
When you go travel also, you have to plan out your medicines and all that. Quite taxing.
So
I think.
talking about traveling, right? Because obviously most of our patients are the elderly group. Yeah. And I always say, during your golden age, you either spend money to stay in the hotel or you spend money to stay in the hospital.
Hospital. Oh, that's a very sad truth. Huh?
Yeah, but it is the truth. So if you do not reverse your diabetes, be prepared to spend money to stay in a hospital.
I rather go hotel.
If
Okay,
you
I rather
reverse
go
it,
travel.
you're healthy, well, travel freely. You don't have to carry along your medications. Insulin is even worse. You need to carry it, under certain temperature. None of those worry anymore.
And you have to control your diet.
Exactly.
Right, when you go traveling,
Yeah,
this one
so-
cannot eat, that one cannot eat.
Correct. When you're taking medications, right? And then you do know like, oh, now is my medication this is too much, my sugar will crash too much and things like that. Sometimes people even forget that whether they've taken the medication or not.
Wow.
So it's tough. So can you imagine you're free from all this?
Yeah. Okay. So coming back to the point where you say that sugar is still in your body. So doctor, what does the patient need to do actually?
We know that the medications don't work. So what do we need to do? That's where we come into the picture. We help patients to reverse it altogether. Yeah. So to reverse it means a few criteria. Number one, we want the HbA1c to be lesser than 5.7%,
Okay.
which means normal.
Normal.
Number two, your fasting sugar needs to be between 4 to 6 millimole per liter. Between 4 to 6. Your 2 hours after meal blood sugar needs to be between 4 to 8 millimole. But all this has to be accompanied by one very important criteria. Without depending on medications,
Wow.
insulin, or supplements. It has to be done naturally.
Naturally. Okay.
That's right.
So just now you mentioned a few examples of the patients that have gone through. Can you also share with us a little bit more about what are the other cases that they have successfully reversed their diabetes?
Okay. Generally, our patients take about 4 to 6 months to reverse. That's general among that 2,000 plus. But recently, I have one super amazing case.
Okay.
This patient, he has been a diabetic for the past 5 years.
5 years.
5 years. He was on 3 diabetic medications.
How old is he?
He's around 50. He's around 50.
50, okay.
Yep. So what happened? I met him. The moment I met him, I helped him to switch off 2 of the diabetic medication. 2. That means 2 out of 3 is gone. He's only left with 1. And that one is actually metformin. Metformin is a very common medication for
Oh,
diabetic.
diabetes. Okay.
Within that 3 days, his sugar crashed. It went
3
down
days?
Within 3 days, can you imagine? I switched off 2 of the medication.
Okay.
His sugar not only did not spike, it actually crashed. It crashed down to about 3.7.
Ah, wow.
So of course he is anxious because 3.7 is considered hypo. Anything lesser than 4.0 is hypoglycemia, low blood sugar, which could be life-threatening. So he immediately messaged me and I told him, look, please switch off your last medication, which is metformin.
Okay.
So this patient managed to switch off his medication within 3 days.
3 days only.
And after I switched out all the 3 medications, for the next 2 weeks, right, his sugar reading was around 5 to 6.
Wow.
That means, think about it, he has been taking this medication for the past 5 years.
5 years.
Within 3 days of meeting me, he realized that I actually don't need the medications
Yeah.
and my sugar reading is good.
So that means he has wasted 5 years
Correct.
and 5 figures perhaps.
Yeah, I don't know how
Ringgit.
much he spent, yeah, but obviously, I think money is not so much of a problem, but the trauma in terms of the emotions and,
Yeah.
obviously all medications also come with side effects. Yeah. So yeah, this is one of my, I would say, our best case so far.
Okay.
Out of the 2,000 over patients.
So I would like to also ask you, how do you normally feel after you yourself had witnessed this kind of cases happening right before you?
Satisfaction, job satisfaction.
Okay.
You see, they always say that a doctor is, of course, to help patients, right? To me, this is really helping patients. We see how the lives of our patients are being transformed. Yeah.
Okay.
So-
I believe it's not only their lives, but their families, the
Exactly.
family members' life.
Exactly. Yeah. It's very common for us to receive compliments from our patients' family members. Because you like it or not, most of our patients are also more energetic. If you ask around among those diabetics, right,
Yeah.
they'll always tell them that they're always tired. You know, yeah, that's
Mentally,
actually
physically.
correct. That's a very common symptom of being a diabetic. They're always tired. The reason why they're always tired is because their body is not able to use the sugar, because the sugar is all in the blood vessel.
Okay.
Yeah. So diabetes is a problem of using the sugar. So their body is not able to use the sugar. That's why they're always tired. Yeah. But once they reverse their diabetes, they regain the energy. They become energetic.
Okay.
Then they're able to spend quality time with their family members.
And doctor, I'd like to ask because I'm sure when you come out with something so unconventional, so unique, of course people might be having some difficult opinions. They even may be attacking you. Hey, why do you say that it can be reversed? It hasn't been done before. So things like this, if there are negative comments coming towards you, and you have good result like this. So this good result, is this a sign of you are doing the right things for the patients?
First of all, I did not come up with this protocol. I also learned from someone else.
Okay.
Yeah, so in the US, there are quite a number of doctors who are doing it. Yeah, of course, back here, we're based in Malaysia here. Here, of course, it's very hard to find doctors like us. But I learned it from other doctors as well. Okay, of course, I localize it. Yeah, I customize it according to the local culture. But having said that, we have patients from more than 10 countries. Because we see patients online. So there's no geographical boundaries.
They don't need to fly over.
They don't need
just
to fly in. Yes,
have
yes.
consultation with you.
I have patients from more than 10 countries. I mean, if you want me to name it, it's like, okay, Malaysia, Singapore, Brunei, Indonesia, even in Vietnam. We have patients in Taiwan, China.
Okay.
Recently, I have one patient from Thirst and Caicos.
Okay.
A country that I haven't even heard of until after the patient signed. I was like, "Where are you from?" Thirst and Caicos. And then I started searching. Oh, okay. That is that place. Yeah,
Okay.
it's okay. I don't even. We better don't start. I fail my geography anyway. And then most recent, I have one patient from Ghana.
Ghana, Africa.
Yeah. So because it's online, the one-on-one sessions are online, so there's no geographical boundaries.
Okay.
Yeah. So you were saying, okay, so I did not come up with it, I learned from someone else. And most people still do not believe that diabetes can be reversed.
Okay.
And I don't blame them. And I also don't expect them to believe in me. Why? Because our health is our own responsibility. It's up to you to believe in which school of thought. I mean, it's your health, right? It's up to you, right? If you believe that the medications are helping you, please go ahead and take it for the rest of your life. I'm okay. I'm not diabetic myself. It's for you to decide. But if you think that you deserve better, you think that, oh, my body should be smart enough to basically reverse it as long as I do the right thing, well, then you have to look. If you believe that diabetes can be reversed, you have to look for a professional who can reverse it for you to guide you step by step. So I'm not going to say that, oh, all other doctors are wrong. No, they are right, in fact, because they are probably following the standard protocol. Yeah. So I'm not going to say who is right and who is wrong. Yeah. So obviously I receive a lot of course, negative feedback and things like that, and people say that, oh, how dare you say that diabetes can be reversed?
Yeah.
Especially some doctors who say, I've been practicing as a doctor for the past 20-30 years. How
And I've
dare
never
you say,
heard of
yes,
this."
I've never heard of this. So why do I still persist despite of all these negativities? Because I believe in doing the right thing.
Yep.
And the right thing is usually the more difficult thing to do.
Yeah, obviously.
Every single doctor, after we graduate, before we become a doctor, we have to, we have a declaration that we have to make. We call that the Hippocratic Oath.
Okay.
And there's these 3 words that is very important in this particular oath.
What is that?
Do no harm. No matter what you do to the patients, do no harm. Even if you cannot help the patients, okay, frankly speaking, you like it or not all cases can be helped, right? Like example, somebody who is admitted into the emergency department after a car accident, not all cases can be helped. Some patients will die. Yeah, but at least even if we cannot help them, don't harm them. So if you ask me, am I going to go back to my regular practice where I prescribe medications to diabetics? I can't do that anymore because I cannot unlearn this knowledge that I already have in me, because I cannot harm my patients.
Even though the patients insist, doctor, I don't want to try this reversing diabetes.
No problem. If
Treat
they
me
insist,
the conventional way. Can you do that?
what I'm going to do, please go and look for other doctors. Majority of the doctors out there, they will prescribe medications to you.
Happily,
you
right?
don't have to come. Yeah, happily. You don't have to come to me. Anyway, I'm running a wellness center and not a clinic. I do need to run a clinic because I am
True.
not selling any medications. I prescribe education, not medications.
Medication.
Yeah.
Oh, wow.
So it's the education that matters. Yeah. There is not a single medications or supplements, okay, or insulin for that matter, that can reverse diabetes. Diabetes can only be reversed using the right knowledge.
Can you just walk us through how do we actually reverse diabetes?
I would say that there's 2 aspects to it. The one aspect is, of course, the diet. Okay. Diabetes is a dietary disease. It can only be reversed using the right diet. You need to know what to eat, what not to eat, and probably when to eat as well.
Okay. Sorry, doctor, it's not from the family. I thought my father has it, then I should have it. The whole kampong have it, then I should have it. It's not that.
That is a myth. Of course, now we are referring to type 2 diabetes. There are so many types of diabetes, but it's basically type 1 and type 2. The type 1 is the more rare one. Okay, but I would say less than 10% of the population suffer from it. Type 1 is the inherited one. So
okay.
type 1 is the one that cannot be reversed.
You born with it somehow.
In a way, yeah. So there's a genetic component in
Okay.
it. So anyone who is diagnosed with type 1, because of the failure in the pancreas, it's an autoimmune disease. So because of the failure of the pancreas, basically the pancreas couldn't produce more insulin. That's why the logical treatment for type 1 diabetic is to give insulin. That is normal. Okay. That's normal. But of course, we still have type 1 patients under our care. Why? Because we can reduce the requirement of insulin by about half. Which is better than nothing, right? Yeah.
Okay.
But for type 2, type 2 is a dietary disease. It is not inherited. That's why you can reverse it.
It's from what you eat, lah.
Correct.
Literally.
It's based on what you eat, your eating habit that is actually causing it.
Wow. Okay.
But the problem is why most doctors tell you that it's inherited. I call this the blame game. You can't do anything about it. Blame it to someone else. The easiest way, blame it to your parents. Because why? You cannot change your parents. You cannot change your genes. Yeah. So it's like, oh, I'm sorry. It's like it's forever with you, and basically, they just want to cut off all the hopes. But for me, I want to give diabetics hope. I want to give diabetics hope. Yeah. That's why, you see, in Clinic Zero, our logo is a life buoy. So why is it a life buoy? I believe that most diabetics, they are drowning in a sea of medications, insulin, or supplements. You think you are floating. Yes. But sooner or later, you are going to drown. And that's where we come into the picture, where we hand over to you the life buoy, but you have to hang on to it. You have to stretch out your hand to actually hold on to it for you to be safe. Yeah. I'm actually I've gotten myself a certificate for being a lifesaver as well. I remember last time we used to learn how to throw the life buoy.
Yeah.
Literally, I mean, I'm talking about a real one.
Okay.
And we always say that, you know, as long as the victim do not hang on to the life buoy, there's no way you can help.
Yeah.
Because it's not all the time that as a lifesaver,
Yeah.
we will jump into the water to
Yeah.
save the patient, the patient, sorry, the victim.
Yep.
Sometimes it's just too dangerous for us to jump into the water.
Yeah. So it's not only okay. I would. Is it fair to say that some patients are like hanging on to a false hope, thinking that medications would one day help me get rid of my diabetes, but they are in a comfort zone that they do not want to step out and see if there's any other alternative way to help them with their issues.
Yeah, sadly, majority are like this. They are not open-minded enough to basically learn. Yeah, and I wouldn't say that they are putting in too much hope that one day they will be free from diabetes, because I don't think that doctors have given that kind of hope, and I think doctors shouldn't also if they are prescribing medications,
Yeah.
because that's wrong. Yeah, because we know that, you know, the problem with diabetes is every time once they are diagnosed, the doctors will always say that you have to take this for the rest of your life.
It's like a life sentence, right? It's
Exactly.
like, okay, from now on, no choice already. Take medications until you die.
Exactly. That's what being told. And to me, to be fair, because I'm also a doctor myself, I mean, frankly speaking, I don't mind if the medications work, you know. I mean, if
okay.
it works, please
Okay.
go and take it.
Okay.
It's good for you.
Yeah.
The problem is, it doesn't work.
It doesn't.
Yeah, that's the problem. If it works, please take.
Yeah.
Yeah, I mean, I'm not anti-medications.
Yeah.
I give a simple example. Anyone with a bacterial infection, if they come to me, right, I'm still going to prescribe them with antibiotics, because that deals with the root cause of the bacterial infection, right?
Yep.
So, yeah, I'm not anti-medications. I'm just anti-solutions that don't work.
Okay.
Yeah.
All right. So,
All right.
wow, we have learned so much today from Dr. Andrew, and I'm sure that the audience, you also like to find out more. Okay, if you are looking for more tips and also ways to reverse your diabetes, make sure you follow us. Go to the link below, and then you will be guided to a webinar where you will learn even more.
Correct. So we conduct a regular diabetes workshop, online or offline. Yeah, so depending on your preference. So come and learn more about it. I want to wrap it up by saying that diabetes can be reversed, but you have to take the right action. You have to look for the right professional to guide you step by step. Don't do it yourself, okay? Because I think I missed out just now. One aspect is the diet, all right, is the food. The other aspect is how do you get rid of your medications safely. That's even more important. Yeah, you probably can Google and find all sorts of information about, you know, how to eat, you know, to reverse diabetes, but I'm pretty sure it will be very hard for you to find information on how to throw away medication. As in, which one to get rid first, how to get rid. Yeah, this is, you know, where you get a reversing diabetes doctor to guide you step by step. It's always personalized, it's always one-on-one. There is no one-size-fits-all kind of regime. Oh, everyone is the same. No, everyone is different.
So do you mean, Dr. Andrew, I cannot do it myself? I cannot DIY my own reversing diabetes?
If you love yourself, if you love your life, don't do it yourself. I've seen too many patients who try to reverse their own diabetes. They started with a diet, okay? They started getting rid of some of the food and things like that, but they don't know what to do with their medication. So they continue taking the medication, and then
okay.
their sugar crash, their blood sugar crash, and they end up in the ICU.
Oh, wow.
Yeah.
So that's why I still have to refer to the
You
expert.
get a reversing diabetes doctor to guide you. Not any diabetes doctor, but reversing diabetes doctor. I mean, if that is what you want. Yeah. Get someone to guide you step by step on a one-on-one basis. Yeah.
Okay.
There are more and more of us around the world. Yeah. So look for them.
Yeah, we definitely have learned a lot from Dr. Andrew today. And to understand more about reversing diabetes, make sure you click on the link below and find out more. Dr. Andrew is always doing things like the webinars, seminars, online and offline, to guide you to reversing diabetes.
All right. Thank you so much, Ian.
Thank you so much.